thanks, Kip, for doing this with me. So we were going to talk today just a little bit about the Trim and Fit protocol, the Trim and Fit with Research protocol, which is our weight loss program. So, with this Trim and Fit, many of the things that people experience is they always say that it's not a painful program to be on because their appetite's actually truly suppressed, and when they eat, they feel really full, which is something that I always tell patients is really different than the traditional way to lose weight. The traditional way to lose weight is people just try to eat less, and they find themselves in the pantry an hour later eating more than they ate before, or they're taking appetite suppressants that really have a lot of negative side effects like blood pressure elevation, jitteriness, anxiety, insomnia. So I just was hoping that maybe you could just say a couple sentences maybe about what your life was like before Trim and Fit and how you felt Trim and Fit, the experience you've had with it so far.
Absolutely. Well, first off, I've done the other ones that you
Mm-hmm.
talked about, and that's the way I always turned out. And the appetite suppressants are not good.
Mm-hmm.
But this has been, for lack of a better explanation, easy. And
Mm-hmm.
it does. I feel like when I eat, I get full quicker.
Mm-hmm.
I feel satisfied. I don't have urges. I don't have cravings. I have sometimes actually have to make myself eat because I don't have those hunger pangs like you
Right.
normally have. So, I feel like, as you've mentioned that the fat can cause the inflammation, and how muscle is good for anti-aging, and that's what it's all about. Anti-aging. I feel better. I think I look better. I know I've lost weight.
Mm-hmm.
It's cost me some money in clothes, which I'll gladly spend.
Sure.
So I can't say enough good about it. Honestly, it's like one of those secrets that you kind of want to keep.
Yeah.
But then again, you want to tell everybody.
So, have you felt like you've had any major side effects with the program? I do tell patients that GI side effects are the most common. Nausea, constipation, sometimes reflux. Typically pretty mild. We're pretty able to deal with those. We do the titration very slowly. That usually helps really minimize those side effects. Have you had many side effects with the program?
I've experienced all three of those, but very mild, minimum, and not consistent. So it's very, and I can't tell you if it happens early in the week cycle or late. I don't really recall, but because I don't experience them that much.
And certainly not something that would be bad enough that you would actually stop the program.
Not a chance.
Right.
Not even close. Honestly, it's like one of those things. It's nothing like you would not experience otherwise in your normal life. It's just that now maybe instead of going, what did I eat or what's causing this, you're like, oh, maybe it's that.
Yeah.
It passes. It's no big deal.
And today we talked about with you how much weight you've lost. You've lost, around 15 pounds of nearly all of that fat. Your body fat now is very much in normal range. And we talked about how today that we're going to go after a little bit more weight loss just because that we're in goal, but we think we can optimize those levels. And I think what you really kind of the feeling I got from you is that this overall has been a fairly easy process, well tolerated, actually maybe even a little bit of nervousness coming off the program because it's been so effective so far.
There is more apprehension to come off than there was to go on.
Yeah.
For sure.
Well, awesome. Well, I appreciate you taking a few seconds with me and hope you have a good rest
Appreciate
of your day.
you taking care of me as always.
All right. Thank you.
Thank you.